PICC line dressing changes need to be completed every 7 days. So when you get started, you're going to prepare your environment just like you would with any other procedure. Prepare the room, the work area, make sure that it's clean. The windows are closed, the fans are off, there's no pets in the area. I already washed my hands, so I'm going to gather my supplies. I need clean gloves, a dressing change kit. I need a securement device. Some dressing change kits do already contain the securement devices, but this particular one does not. And then I need a way to wash my hands after I remove the dressing, so I have hand sanitizer. I'm going to open up my dressing change kit just to get the mask out. One mask is for me, one mask is for my patient. Or if my client has a trach and I have someone here assisting me in case my client needs suction, then the mask will be for the second person. I'm going to put on my clean gloves to remove the old dressing. When I'm removing the dressing, remember I want to stretch flat against the skin and always work from the bottom up. I'm going to stabilize that insertion site, remembering that with the PICC line there is no internal stabilization, and ordinarily there would be a securement device in place already. Now that I've removed the old dressing, sorry, it's a little bit difficult to stabilize on the mannequin, but now that I've removed the old dressing, I can take off my gloves and wash my hands. So since I have the securement device separate from this packaging here, I need to remove my sterile field. I'm going to be careful to touch this shiny side since that side goes down, and handle it just by the corners. And then I can open up my securement device, place that on the sterile field. Now I'm ready to put on my sterile gloves. Now I can prepare the supplies that I need. This particular kit comes with the ChloroPrep swab stick. Again, taking a look at the instructions and noting with this particular swab stick, I scrub for 30 seconds and then allow it to dry for 3 minutes. The iodine ointment, which I don't need to use for this client unless they're sensitive to ChloroPrep. Then the new dressing, the 2x2. And the skin prep. So I'm going to use the 2x2 to pick up the line. I'm going to scrub the site for 30 seconds using back and forth strokes. You want to be very careful not to move the line. And then if your kit comes with an alcohol wipe, you would use that to scrub the line. If it doesn't, then you can use ChloroPrep to clean the line. Again, being careful that remembering that PICC lines are not secured internally. So you want to be careful that you're not moving the line in and out. Again, it's very difficult with the mannequin, it moves very easily. But I would scrub the line with the ChloraPrep, remembering that there's a risk that that will dry sticky. Once I finished cleaning that, then that needs to be allowed to dry for 3 minutes. And then I'm ready to apply the securement device. There are different types of securement devices. This particular device has the wings that stretch. So this requires a little bit of maneuvering to get the wings inside of the securement device. And then once I have that in place, I'm going to carefully remove the dressing from the back side of that. Securement device is in place, my line is stable, and I'm ready to place my dressing. With the dressing, again, I want to make sure that the insertion site is in the center, but I also want to cover the stabilization device. With this line, we don't have a whole lot of room to work with, so I'm getting pretty close to the clamps as well here. I'm actually going to slide those down just a little bit. Then I would secure the dressing to the arm. And obviously, if we had a full-sized arm, it would wrap around there just a little bit better, but do the best we can. I also omitted the step with the skin prep. We don't use that on our mannequins, but you would use that after the ChloraPrep is completely dry. You would apply the skin prep before you apply the securement device. Then once I get the tape on there, I can remove my gloves and I can remove my mask. I can use my pen to label with my initials and today's date that I completed the dressing change. Then you would use a piece of tape to secure the line where it comes out of the tegaderm. Since it pretty easily pulls up the edge of the dressing there, you'll use a piece of tape to come underneath onto the edge of the tegaderm. It's a little bit difficult on this half arm here and with the two lines coming out. So then again, tear it halfway through. Come from underneath onto the edge of the tegaderm. And then one more piece. Again, tear it halfway through. Place this one over the top on the edge of the line. And then one more piece for the other lumen. Again, tear it halfway through. And then over the top on the edge of the tegaderm. Again, this gets a little bit messy on our small arm here, but you can understand that we want to secure the edge of the tegaderm so that if the line does get pulled on, it's more stable on the bottom edge there. Then I need to complete my assessment of the site. So I want to identify the insertion site. Is there any complications, any drainage? Is the skin warm? Is there any redness? Is there any palpable cord above the insertion site? I also want to use my measuring tape to indicate the line length in centimeters from the insertion site to a predetermined point. So for this client, it's probably easiest to measure to the top of this hub here. So that would be 1 centimeter for this client. Then I also want to measure the arm circumference, and our standard is 10 centimeters from the antecubital. And so I apologize, you can't see that very well, but this would be 10 centimeters at this point here. So I want to measure arm circumference at that point. So again, then documenting the arm circumference there, and documenting the integrity of the site and the cares that I performed.